everyone. It's 3:30 p.m. on Thursday, April 9th, 2020. Thank you for joining us. I'm Janet Hill, the Chief Operating Officer here at the Rock Island County Health Department. Today we are joined by Nita Ludwig, the Administrator at Rock Island County Health Department, and Ed Rivers, the Director of the Scott County Health Department. In addition, we have Doug Cropper, who is President and CEO of Genesis Health System, and Dr. Bahrat, Motwani, who is an infectious disease physician and expert at Genesis. We also have Bob Erickson, President and CEO of UnityPoint Health, and Angel Mueller, who is Director of Quality Accreditation and Regulatory Infection Control at UnityPoint Health, Trinity. After prepared statements, all participants are here to answer your questions to the best of their abilities. We ask that you direct your questions to the person you are addressing in the chat box. The question and answer section will be moderated by Brooke Barnes of the Scott County Health Department. Nita, please start us off with the reporting of Rock Island County's cases for today. Thank you.
Thank you. The Rock Island County Health Department is reporting the death of a third COVID-19 patient in the county. The patient was a man in his 70s who had been hospitalized. We are saddened to report our third death in Rock Island County. While anyone can contract COVID-19, the virus is most dangerous to older people and people who have underlying health conditions. We strongly urge everyone to stay at home to give our residents most vulnerable to this virus the best chance to avoid getting sick. Staying home especially is important for younger people who do not feel ill, but who can transmit the virus without even knowing they have it. The health department is also reporting 12 new COVID-19 cases, bringing our total positive cases to 85. 6 patients are currently hospitalized. Now I will turn it over to Mr. Ed Rivers.
In Scott County today, we're reporting a case total of 88. That's an increase of 11 from yesterday. We know that one of those is hospitalized. The arrival of April brings several major religious holidays and observances. We acknowledge the important role of faith and religious observances play for many in our community, especially during times of uncertainty such as the one we're currently experiencing. We urge our faith community leaders to protect public health by following both the Illinois and Iowa Departments of Public Health and the CDC's guidelines restricting social gatherings in large groups. We encourage faith leaders to continue to explore and provide alternative options for offering online or other remote access worship services or messages. We ask for your understanding in this trying time and that you protect the health and safety of your faith communities by postponing or canceling all social gatherings until social distancing recommendations have been lifted.
Thank you, Ed. Now we will hear again from Nita Ludwig with the Rock Island County Health Department. Nita?
Hello. We wanted to go over just a bit of cloth face coverings. The CDC has released updated guidance on the use of cloth face coverings. This guidance recommends wearing cloth face coverings in public settings when other physical distancing of at least 6 feet is difficult to maintain, such as grocery stores and pharmacies. The use of a simple cloth face covering is intended to help slow the spread of the virus and help people who may have virus and not know it from transmitting it to others. The CDC also recommends that workers in essential businesses who can't maintain social distancing, again, such as grocery stores and pharmacies, wear cloth masks while working. Surgical masks and N95 masks are important personal protective equipment that is needed for our healthcare workers and first responders. Members of the public should not use N95 or surgical masks in order to preserve them for those workers who need them most. We must note that wearing a mask in public does not minimize the need to practice physical distancing and good hand washing. These will still be our greatest tools for helping slow the spread of COVID-19 in our community. Directions on how to make a cloth face mask are on togetherqc.com. Thank you.
Thank you, Nita. Next, we'll hear some information from Doug Cropper with Genesis Health System. Go ahead, Doug. Thank you.
Thank you, everyone. And it's a good opportunity for us to be able to come on, both Bob Erickson and myself, to be able to give some statements and answer questions about what we're seeing from a health system standpoint. And again, I have Dr. Bahrat Motwani on with me, who's our infectious disease expert and has a tremendous amount of clinical expertise. So I'm going to give a statement, and then we'd be happy to answer whatever questions you've got. First of all, I'd say I've worked in healthcare for 39 years. In my history in healthcare, this is unprecedented. We've not seen this kind of worldwide pandemic before. We've not seen this kind of situation before, as it's impacted, everywhere within the United States. Gratefully, we're not a hotspot. We're going to talk about that a little bit more, but this is certainly not life as usual for healthcare and the health system. I would say just up front that we've had very good collaboration, which I appreciate, both between Bob and myself and between UnityPoint and Genesis. We talk frequently during the week, and we've collaborated to jointly prepare for our surge plans for COVID-19 patients. Next, I would mention that Genesis is not currently experiencing numbers of patients that would delete the supplies and or our staff's capability to handle them. You read of things that happened in Italy or New York, and we see pictures on CNN, and that's just not our situation. We're currently caring for 36 patients at Genesis. That's within the whole system. These are patients who are inpatients and have tested positive, or what we call patients under investigation, PUIs. And that's ranged over the last few days, anywhere from 30 to 41 patients. Yesterday we had 41, and it's down to 36 today. If you look at all the modeling, and I'm sure we'll have some questions about the models and everything that's on the national media, they predict the peak within Iowa or within our region to be April 27th. So it's about a 60-day time period where this is predicted to have the cases ramp up and then ramp back down again. If you look at our calculations in relationship to that, we believe from a Genesis standpoint, as we've modeled this, we're going to see 3 to 4 times our current volume of what we're currently seeing. So if you ran our volume to around 40 inpatients right now, that's both ICU as well as medical patients, we would expect to see somewhere around 90 to 120 total patients. That's both ICU and medical patients. We are prepared and have plans from a Genesis standpoint to handle more than 400 patients. So that's 3 to 4 times what we think is actually going to happen. So we can talk about that a little bit more. That would be more than 300 medical patients beyond our current capacity and 100 more ICU patients beyond our current capacity. Now, let me just clarify something that people are going to want to talk about. And that is, for example, today, there is a lead article on the Washington Post that asks the question, is your community at risk for the hospitals being overwhelmed for medical patients, ICU patients, and or ventilators? What those models don't take into consideration is the amount of planning and work that we have done as a health system, or that UnityPoint has done to prepare for a surge. For example, our normal ICU capacity would be 25, but we plan on putting in place and have planned for capacity for over 100. So that's 4 times our normal capacity. And by the way, because I know some of you are very interested in ventilators, we can staff, normally about half of the ICU patients are on ventilators with COVID-19. We can staff up to all of our planned ICU surge beds. That would be over 100 ventilator patients. So we have capacity to be able to care for way more than we predict we're going to see within the Quad Cities. And those models, or those tools like on Washington Post, are simply not correct, because they look at our existing capacity, not our surge planning. Next, I would mention, we do not believe we'll face the difficult ethical issues, for instance, that they're seeing in New York City hospitals. Again, why? Because we've had more time to plan. And number 2, we just have more capacity than we think is going to be needed within the community, based on governors doing things like shelter in place and all the things that have been closed. That's flattened the curve within this area. Next, I'm going to go into a little bit more about our surge plans. that have created such significant capacity. The first thing that happened with all the hospitals in this region, UnityPoint as well as us, is under the CDC guidelines and under CMS's request, we decreased our volume by canceling elective cases. So we're operating at about half of our normal volume within our hospitals. So that freed up tremendous capacity because we're still significantly less than our normal volume. On any given day, like a Thursday today, we would have close to 350 inpatients in our hospitals, and we're running closer to 200. So that gives you an idea of how much capacity that created. Beyond that, we've expanded our medical capacity and our ICU capacity, doing things like transforming recovery rooms for surgery that's only doing emergency surgery, and ORs that would normally be doing surgical procedures, because we're only doing emergency surgery, into ICU type beds. And then we've also created more capacity in our ventilators by planning for the use of anesthesia machines and other machines that can be used to increase the number of ventilators that we have. If needed, from a Genesis standpoint, we have the West Campus. And you'll remember a few years ago, we moved all short-term medical surgical patients from the West Campus to the East Campus, which means we have more than 100 beds on West Campus and an ICU and an OR area that goes unused, and we could expand into that if needed. And so those are some of the things that give us such increased capacity. Next, I would mention another item that gets tremendous attention nationwide, and that is personal protective equipment. We monitor this every day. We have 7 areas that we monitor: gas and gowns, or masks, and gowns, things like N95 masks. And we believe we're in pretty good shape in relationship to those items. I can talk more about that if there's questions related to that. I would also mention that we plan every single day. Almost all of my time and my executive team's time for the last month has been spent in planning for and making adjustments on those plans in relationship to COVID-19. I have a great team of physicians and nurses. I would compliment our physicians and nurses. They've stepped up and done a fantastic job in both caring for the patients that we've had so far and also planning for the future. Our philosophy is we plan for the worst and hope for the best, and we truly are somewhat hopeful about this based on all the recent information that's come out. I tell all of our people that this is not a sprint, it's a marathon. It just happens to be a marathon where your hair is on fire, but it's still a marathon rather than a sprint. Lastly, I'd just like to thank the community in my statement. Companies like Sears Manufacturing, Hahn, people at the Arsenal, Western Illinois University, Deere, and others who have stepped up to help us with personal protective equipment, increase our supplies, help us put in reusables. The community has been fantastic. We've had more than 500 seamstresses who have helped us sew reusables for our personal protective equipment, and I would like to thank them for everything that everybody has done to be able to help us with this challenge. So with that, I'll end my prepared statement.
Thank you very much, Doug. We will next hear from Bob Erickson with UnityPoint Health Trinity. Please go ahead, Bob.
Thank you. Good afternoon. And I won't repeat the excellent summary that Doug just laid out for you, except to reiterate it's been a true pleasure to come together in this community with Genesis, with Doug and his team, really with all the health agencies, the municipalities, the community members, business and industry, to really face this together with one goal in mind, is to mitigate the impact and potential impact this would have on our community, our friends, our neighbors, our loved ones, our team members, and to be prepared that we can continue on doing the good work that we need to do to address this pandemic. While surge planning and pandemic protocols are part of ongoing emergency preparedness for ourselves and any healthcare system, this is a fairly unique and quickly changing situation with COVID-19. And as mentioned, we're anticipating increase in COVID-19 cases in our region. I'll share with you our numbers through UnityPoint Trinity in the Quad Cities and Muscatine region. To date, we've done over 850 tests We are waiting results on about 250 of those tests, many in our clinics, many in our hospitals, our emergency department, and we've had 91 positive cases throughout the Quad Cities and Muscatine in our health facilities and services. Our current inpatient volumes, we have 12 hospitalized patients that are COVID positive. Half of those are in our ICU, half of those are in med-surg. And as Doug mentioned, we're patients under investigation that are highly suspicious and symptomatic. We have 18, so that gives you an idea of roughly 30 or so patients hospitalized. And we've had different degrees of variation with that throughout the last couple of weeks as well, but we're trending upward as the weeks go by. So the modeling, as Doug alluded to, is showing some promise. And so I want to commend the community because the social distancing and the difficult decisions made throughout the Quad Cities and Muscatine seems to be working. And while it's encouraging, we're not backing down in our planning and preparedness for every scenario, as we all know, it's a very, again, fluid situation with a lot of variables in communities that could impact the volumes as we go forward. What we've done, much like Genesis and working together, is we've set up our incident command and emergency preparedness team for the last month. It's 24 hours a day, 7 days a week, with really our main and mostly only focus on this situation. We set that up so we could be quick and agile in decision. We could reallocate resources quickly where needed, and we could really have an all hands on deck as a health system and for our community to be prepared for the influx of patients. Our plan, similar to Genesis, is laid out in phases where if patient influx escalates, we can have clear guidance on when and where we would expand medical beds, intensive care beds, emergency department beds, and how we would staff those, how we would equip those, and how we'd have the supplies necessary to take care of that. We want to be prepared, and we want to work together so we can make sure that we are ready to take care of all of our community during this pandemic. We're working with experts in all areas of the organization and disaster response professionals to make sure we're ready for all scenarios. Our medical staff has been a tremendous asset. They meet with us daily to share the information they're gathering from around the country from their colleagues that have gone through surges, and to make sure we've got the right treatment protocols, the right emphasis and priorities, as this is not your typical day-to-day healthcare operations anymore. As Doug mentioned, we as well have decreased virtually all of our elective procedures and are really focused on this pandemic. Our incident command team is both at a regional level, at a system level. The community coalition has worked together. We touch base with regularly. Our friends at Genesis, we touch base with often during the week to make sure we're working together. And with that, we're addressing many of the same issues. Our leaders and team members are working tirelessly to make sure we're appropriately utilizing, conserving, and procuring solutions to maintain our inventory of masks, gowns, and other PPE equipment so we can reduce exposure risks and keep our communities, our patients, and our team members safe. We're very transparent with that. We post daily what our count is in all these areas, and we replenish both with traditional and non-traditional means. And I would echo the comments, our community has gone above and beyond to help us in this regard. Whether it's the dentists, whether it's people in industry, whether it's people sewing masks, you have our back. And we are extremely appreciative and couldn't do this without you. The next few weeks will continue to challenge us, and we will focus on being agile and transparent and continue to assess what the model looks like to make sure we can shift resources to address the changing needs. I'd like to say it again, we know that this time is a strange time for everybody, whether it's schools being out, whether it's sporting events being canceled, whether it's the impact, economic impact on small businesses and very large businesses. We know that that is impactful in this community, but it seems to be working. And so we want to express our appreciation. We need to stay the course to make sure that we can continue to be prepared and really mitigate the potential surge of patients in our communities. That being said, we're confident that in working together as health systems, we have the capacity right now to take care of our communities. And as we surge up, and hopefully the model continues to trend in a positive direction, we'll be able to surge up and take care of our patients and our community. So I'd like to end just taking a moment to let this community know how amazing you are. I'm fairly new to the community, but in these most challenging times, to see everybody come together to support us in every way possible. You're providing much needed supplies. You're sewing handmade masks for our staff. You're showing our healthcare workers incredible support as they fight for the health of our community and our patients. And it's inspiring. We'll get through this together. We'll rise together to make sure that we get on the other end of this. And we'll continue to show up each and every day as healthcare providers, as healthcare systems in this community for you and your loved ones. So with that, thank you, and I'll stop so we can move on to questions.
Thank you very much, Bob. A sincere thank you to each of the partners for being on the briefing today. We recognize the level of planning and coordination that goes into a community response, such as the one being undertaken for COVID-19. Well, as you said, we'll now go to the questions portion of the briefing. We encourage you to send your questions through the chat and indicate to which partner the question is directed. And we'll do our best to get to all the questions in the time that we have. The first question we have listed here, and perhaps this can go to Doug since you mentioned the model first. Are Genesis and UnityPoint relying on the same model? And is your model made in-house, or are you relying on models of a third party?
Well, we have multiple models. We started to build our own model at Genesis more than a month ago when it was clear that this was going to be a U.S. pandemic. There are multiple models in the country that we look at. Probably the one that I think most people use is the Institute for Health Measurement and Evaluation out of the University of Washington and Washington State. They update those projections daily. The only thing about that model that is not 100% accurate about our community, or for instance about Iowa, is that they do not have all the restrictions, given the fact that there is not a shelter-in-place order in Iowa. They're not familiar with the number of things that have happened, for instance, school closures and others that predict somewhat the model probably a little bit not as conservatively as it should be predicted. But IHME is probably the model externally that is the most frequently used within healthcare. Now, in addition to that, I should say that I'm involved in the American Hospital Association, and we're constantly comparing notes with other hospitals across the country. I was on a call yesterday with the American Hospital Association board. So there's just multiple sources that we have, and we're doing a lot of comparison with both those who are in the situation we are, as well as those who have gone before us. So.
Thank you. Bob, did you have anything you wanted to add to that, or would you like me to go to the next question?
No, I would just say it was interesting when we started down this path. We were using different models, and they compared relatively well in terms of potential impact. So while there's multiple models, I mean, the statistics and the way that this virus has been behaving in other parts of the world and country, they're able to model it. That being said, there's a lot of variability to these models. And so it tries to predict when the surge and the impact, but they were pretty similar. So we've been able to work with Doug and his team to submit to the governor in Iowa a plan that we worked on together, and used a common model. Our system, UnityPoint, uses a little variation of that, but the numbers all are fairly similar as we get more and more data on the pandemic.
Can I add maybe just one more thing? I think one of the things that's really different now is it's clear based on where we're at on the curve, given the fact that we've had, started cases in a significant way over the last couple of weeks. It's a little bit easier to predict than it was before the cases really started. So the situation, once you get into it, is a little bit easier. And that's why, Iowa State or the state of Iowa governor's office made a statement today that they thought the curve was flattening, because you can look at it a little bit better than you could a month ago. So.
Thank you. The next question is for both hospital systems. How many medical professionals in each system have tested positive or are presumed positive? perhaps you could each respond to that question. Bob, do you want to start?
I'm sorry, I was on mute there. So, you know, we have, as this has progressed and even the recommendations for PPE and things have changed, and we know there's patients that are asymptomatic, and we know there's patients that even test negative or it's not detected and later they might test positive. And so we've got a fairly sophisticated, much like the public health department's mechanism where if we feel there's exposure, we are able to trace down every contact then with a patient, whether it's in the clinics or the emergency room or in one of our units. And then we're able to test our healthcare workers and do the precautions necessary to make sure that, one, they are safe, and two, that they're not unnecessarily exposed or exposing other people as we go. As we've been able to get better guidelines, I shouldn't say better, but more sophisticated guidelines with PPE, you know, it becomes a little bit less of an issue. I shouldn't say less of an issue, we're always concerned, but we're finding with proper protocols and adherence and compliance to the PPE guidelines, we feel our employees are safe. In terms of overall numbers, that's not something we would share publicly with due to respect of privacy of our employees.
Thank you. Doug, would you like to address that for Genesis?
Well, I will share publicly just because it's going to give some comfort. You know, we have thousands of healthcare workers, but to date we have 2 who have tested positive out of those thousands, which I think says how effective that our protocols have been, that Dr. Motwani and others have put in place regarding PPE. We know one of those individuals, based on their exposure, was exposed outside of their work situation. And the other one may have contracted it at Genesis while caring for patients. And it comes down to you know, how effectively the PPE was utilized. So I could report that there are 2 healthcare workers in our community. One we believe could have contracted it at Genesis while caring for patients. One we believe contracted it in the community.
Thank you. We do have another question regarding to employees. Have either system laid off or furloughed employees during this process due to elective surgeries being stopped, for example?
So I can go
Doug,
first.
You want to go? Sure,
Yeah.
Go ahead.
Yeah, so you have to understand kind of what's happened to hospitals and healthcare systems across the United States. And that is, most people think we're incredibly busy, but for the most part, Genesis is an outpatient health system. 65% of our revenue comes from our outpatient work. And it's that outpatient and elective work that has slowed down dramatically. So our revenue is running significantly under what our current run rate is. And so, yes, have we furloughed people? We have, in those areas where services have been closed or slowed down or discontinued. So there's a large part of our system that is, you know, slowed down in some cases to nothing or almost nothing. And then there's parts of our system, it's very schizophrenic. There's parts of our system where we're very busy, like in the ICU, and then there's parts of our system where we're drawing from that work pool of people, like from the OR, and we're cross-training them to be ICU nurses. So there's more than 100 nurses who have been cross-trained. So it's a very dynamic situation that changes on a daily basis as we adjust to where are we busy, where do we need to ramp up and plan for ramping up even further, for instance, training people to be ICU nurses, and then where are we very slow and some people are on temporary furlough.
Yeah, I would respond to that very similarly, where you know, we've seen our business model change dramatically as more and more healthcare has moved to the outpatient ambulatory market. That's where a lot of business, so to speak, and volumes occur, and we've purposefully suppressed those so we can focus our supplies, resources, and all of our people on the all hands on deck for the pandemic. The last few weeks, as we've been in incident command, we have a labor pool where if volumes are slow in an area, people report to the labor pool and they may be redeployed where the needs are. So we've done some cross-training with nursing staff that might be in an ambulatory setting to try to get prepared for a surge of patients with their skill set as well. We've had all sorts of tasks and activities to get prepared, from terminal cleaning of facilities to developing real-time policies as regulations have changed. Things like, the governor of Iowa put out a mandate actually that to check temperatures of all healthcare workers as they come into work every day, which is another way to keep everybody safe. So we have to quickly react to that and need some resources to help us sort of put that into action, which is more challenging than one would think. But as we go forward now and the volumes continue to be suppressed, yes, we've got to look at matching our resources to where the volumes are, and then be prepared for the day when it arrives that we can get back to doing more and more ambulatory procedures. So it's got impact on healthcare workers as well.
Thank you. Another follow-up question to the same individual. Have either systems been asked to send any underutilized equipment to other areas with more need, like Chicago or New York?
So would you like to go first?
Yeah, I can respond to that. There's been requests, and we haven't been able to meet those requests outside of the area, as we're trying the best we can to, especially with PPE, make sure that we're preserving that for our communities here. We do have, as UnityPoint has hospitals throughout Wisconsin, Illinois, Iowa, we actually have started a day-to-day check of supply in case one area within our system surges much more significantly than another. We know, for instance, ventilators that could be transferred, or PPE, or even staff members if needed. So the request from outside of our system at this point, we have not been able to respond to. And everybody throughout the country is kind of dealing with the same issues in terms of how this acts in their community. So we're making sure to take care of our communities first.
Yeah, my answer would be very similar. We've not received any specific equipment requests. We have received PPE requests. We're being very conservative though, and especially given the fact that we're on the upside of the curve, we believe we know what's going to happen, but you have to prepare, and we have to make sure that we're able to care for our community first before we help others. I think one of the things that we would make sure that we would do, and I'm sure Bob would do the same, is if we saw a situation where Bob had a ventilator issue and we didn't, or vice versa, I'm sure we'd share within the community as well. But we're being very careful to make sure, both at Genesis and at UnityPoint, we can care for the community and keep our employees safe with PPE as well.
Yep, and we do that with Genesis. We have had requests within the community, whether it's skilled nursing facilities, other medical providers, some of the responders in different departments are worried about PPE and things like that. And we've sent teams over to train on appropriate use. We've shared some of that with them. So we're trying to work across the hospital and clinics traditionally into the other areas and aspects of the healthcare continuum and the community continuum that's impacted by this. And that we have no issue sharing expertise, sharing the supplies we can, whatever that might look like, so we can work together to keep our community as safe as possible.
Thank you both. The next question, we're going to turn to the Scott County Health Department with Ed. Ed, have you seen any positive tests of county employees or employees of the Scott County Sheriff's Department? And the next question is, have any inmates from the Scott County Jail had to be tested for possible COVID infection? If so, how many of the inmates tested positive?
Well, as you know, the Scott County Health Department can report only those positive cases released by the Iowa Department of Public Health. That number for today is 88 positive cases, and we cannot be more specific. However, I can say that our staff, the Scott County Health Department staff working in the jail, screen all incoming inmates, and they're working very hard to make sure that the opportunities for transmission of the virus in the jail are as near zero as possible.
I'm going to skip ahead. The same question was listed as well for Rock Island County. Nita, would you like to respond to that for your side of the river?
I'm sorry, I think I muted myself by accident there. Yes, the same really is true for the Rock Island County side of the river. We would not be identifying any specific employees of any workplaces or living locations, congregate centers. What would happen is our infectious disease nurses, if anyone tests positive, no matter where they work or live, our nurses then work backwards to figure out where that person has been and who may have been close contacts with that person. And then they would give them education and guidance about what to do next, if they need to self-isolate or if they could continue working. It really depends on their occupation and their level of exposure at this point.
And Nita, are you able to say anything regarding the Rock Island County jail population as well?
It would be the same. That's what I am calling a congregate living facility. So we would not speak directly to who might have been tested or positive at those locations. But if they needed to be tested, they would be tested according to the guidelines from the Illinois Department of Public Health.
Thank you. Bob, the next question will be for you. What are UnityPoint's capacity numbers, and how many ICU and ventilators does the system have?
Sure. So that's part of the benefit working together with Genesis and submitting a plan. It looks like from a community perspective, the two systems together, and it's fairly equal, could surge up to about 160 ventilators within the community, and that gets creative as we look in this situation, like potentially using anesthesia machines and things like that. But we track our ventilator use every day in terms of what's in use, what's not, and what's availability across our hospital sites. Our surge numbers are pretty similar, where if needed, our surge plans at the, if we go to the ultimate level of need, we can get up pretty close to 90 ICU beds by redeploying different units, as Doug referred to, or looking at different areas where that'd be appropriate, and somewhere around 400 med surge beds that we could dedicate to it across our campuses. The biggest issue there isn't necessarily the physical facility or the equipment, but to make sure we would have the staffing, both the provider, physician staffing, the nurse staffing, respiratory therapists, EDS workers, I mean, everybody. That's why we look at that all hands on deck. But our surge numbers are pretty similar. Where we could probably handle up to 3 times or so our current census.
We do have a follow-up question to that. Doug, I know you already described Genesis's numbers. We had an additional question on that. Perhaps you or someone else could just type your capacity numbers into the chat so that we can move on to the next question. Thank you. The next question we do have is for both health systems. You said you're confident medical care or equipment won't need to be rationed, but God forbid if that were to happen, what are the ethical guidelines or frameworks the hospitals are relying on to inform those decisions? Doug, do you want to start and describe the process that the hospital system uses for that?
I think Dr. Motwani can comment on that as well. We just really believe that we will not face that situation. There are ethical guidelines that physicians have looked at developing across the country. Do you want to talk about that?
Yes, and I want to emphasize that we are evaluating the situation every day, and if we think that we'll come up to that point, we are ready to develop those ethical guidelines based on the national guidance and what's happened in New York and Italy and other places.
Yeah, but again, you have to remember that, and I think the same is true at Trinity, that is true at Genesis, is we're prepared to take our ICU capacity times 4 what it normally is, and we can staff every single room, one of those 100 rooms, with a ventilator. So it's just really, it's so unlikely. And
I would agree. You know, again, this is played out differently in different communities, and we've had a little bit of a gift of time to sort of get prepared. And like most hospitals or health systems, we have an ethicist, we have an ethics committee made up of physicians, nurses, community members, ethicists, people from the academic world that guide us in these types of situations should they ever occur. Again, we're confident we won't get to that stage here, but if needed, they have looked at guidelines across different systems, different regions, used the process to plan in advance for a worst case scenario, should that happen. So we've got guidelines that our ethics committee and our boards and our providers would have looked at, signed off on, approved, because if it ever gets to the time of crisis, it's not the time to be making policy in something like that. So they're prepared. You know, we all do worst case scenario planning too, but there is a process for that in most health systems where you've got a bioethics committee and made up of a pretty robust group of people that are well educated, can help guide us with the right lens.
Thank you both. The next question, nearly every day the media gets calls from medical professionals who don't feel safe working at the hospital systems but fear repercussions if they speak out publicly. What are you doing to address those concerns? Bob, would you like to start with that, please?
Sure. So, you know, there's the science of protection and infection prevention, and then there's the emotions of it. And they're both very significant. You know, it's a scary time for people in the healthcare workforce as they see news all across the country of people that have been exposed, people that have gotten really sick. They get different messages from all sorts of different sources, even in the medical field. The different professional associations in different specialty areas give different advice on what it is. So we try to, number one, stick with our guidelines that are based on the science of it, whether it's CDC, WHO, and make sure that our clinicians and our staff are safe. And some of those guidelines have even changed. So we start there being very transparent with policy. And then what we've done is we do a lot of just one-on-one. We've got PPE expert teams that round and go out and re-educate on proper use, what the policy is. And even with that, you know, people are scared and they may post things or feel unsafe. So when we find out about those things, we try to educate, make sure they understand what we're doing, how it's keeping them safe. That's why we're really transparent with our PPE count every day. And then try to work as best we can. In terms of, you know, repercussions, we're not going to be punitive against somebody who's scared and is voicing their concern for it. We're going to try to educate, support, so we can all get through this together.
Yeah, my answer would be very similar to what Bob is saying. There's the science of this, and then there's the emotion of this. It's something I'm personally involved in every single day. We have a group that gets together that looks at our PPE supplies every day. You know, PPE, I should mention as well, maybe something Bob didn't hit on, is influenced by, PPE supplies influenced by 5 factors. What did you start with? What was your supply at the beginning? What is your use rate? We sometimes call that our burn rate. How are things going from an acquisition standpoint? That changes every single day, and we've been extremely aggressive there. What kind of donations are we getting? And then what's happening with reuse? So for instance, Sears Manufacturing is going to sew 2,000 isolation gowns for us out of cloth. Almost all isolation gowns are disposable. So when we go to the cloth in our ICU, which is going to start on Monday, we'll decrease our disposable rate. So all of these factors influence PPE. Now, let me just comment on the emotion of this. I worked as a healthcare provider. I worked in surgery for 3 years, and we have something called universal precautions. You know, I was a surgical technician for that time frame, you know, you gown up and you make sure you're protected and you make sure the patient's protected. But there's also an emotion around this, and Bob did a very nice job describing this. We've been very conservative on our PPE guidelines, but we follow the CDC science guidelines. most of the challenge that's happened with PPE is from employees that are not necessarily in high-risk areas that feel like they need to have more protection that is provided in the CDC guidelines. So we've been very strict about following the science because we're trying to be very conservative. And I round every day in patient care areas. I try to round every day in our highest risk areas. Just yesterday, I was on our medical pulmonary unit talking with nurses, and I asked them how comfortable they are. And surprisingly, the employees in the high risk areas are quite comfortable. And we're making sure they're well protected. But this is something that is very, very important to us, employee safety and employee protection. We think we're doing well because, again, we've only had one worker that may have been infected, and we're not sure about that one. And that's over the course of, kind of a month of caring for patients. But the emotion of this is very difficult, and Bob's done a nice job of describing that. It's a situation of we're all fearful of what this virus could mean if we caught it individually.
Thank you both. Can either of you speak to the turnaround time for getting test results back right now?
Well, I'd love to speak to that because it's changed so dramatically. This is one of the things that's been a national issue, and where we started, a month ago or 3 weeks ago is completely different than the situation today. It changed really over the weekend, and we were seeing, and I can give our numbers, Bob gave his numbers a little bit earlier, but we've done actually the number of individuals tested, some of them are outpatient, some of them are inpatient, within Genesis is just under 1,200. So we've done a lot of testing. And the turnaround time for those tests, in some cases, was as long as 2 weeks up until the weekend. It was extremely slow. There's 2 testing locations. You have to think of collection and then testing as being 2 separate things. So we collect it within the health system, but it's tested. These tests are done outside of the health system. They're done within the state labs, and there's a state lab that we use in Illinois and also one in Iowa. The state labs have had pretty good turnaround, 2-day turnaround, but there's only a few patients that meet criteria for being tested within the state labs. All the rest of the patients have to be tested in the commercial system. And for us, that's LabCorp. And those were extremely delayed. Now, what happened over the weekend is they've caught up, and we had hundreds of tests outstanding on Friday. And just as of today, let me grab the file here, and I can tell you, I think it was just over 100 tests outstanding, and almost every one of those tests was less than 2 days old. Now, in addition to that, Genesis just today received its own testing equipment from LabCorp, which means within 10 days from now, we will be able to do our own tests on site. Our testing capacity will be limited at 100, but testing is one of those situations that started out really, really bad and has improved dramatically. And in 10 days at Genesis, will improve even more, where we will have 3-hour turnaround time for our testing. Dr. Motwani, did you want to add anything on testing?
No, I think Doug has done a very nice job of summarizing everything. I just want to say that we are testing a lot of people. We are testing even people outside the state criteria so that we can capture high-risk patients in the community and know how much transmission is going on in the community.
And we've seen improvement too, where it's 24 hours to 72 hours. We use private labs as well as the labs that states as we go. It's a national issue. There's shortages of reagents. There's shortages of testing equipment that's being shipped to kind of the hot areas that are really seeing high surge. So we're hopeful as time goes by that, and we see more and more coming to market, that we'll have availability to access that as well. So it's improved, which is good news, and hopefully it'll keep improving.
Thank you. Are the vent and surge numbers for any hospitals outside of Scott and Rock Island County? Do you want to address that first, Bob?
So ours includes Muscatine. We have a hospital and clinics there, and we've kind of looked at, the surrounding areas and how to work with, some of the hospitals that are in a little bit smaller population areas and how they would fit in with our surge plans as well. So Doug's done a great job having more established relationships, as I'm newer, in terms of linking and including those facilities in so they can be part of our planning. So we look at all different opportunities to work with some of the smaller rural hospitals, and one, giving them support, and two, maybe how we would work together should the surge become, significant or in a shorter time period than we'd anticipate. That could look at how we work together in terms of continuum of care.
So just to add to that, we have a surge plan that's kind of for the Quad Cities, and then I would call it Quad Cities Plus, and that would include Clinton, Hammond Henry we've invited to be a part of our planning, as well as Mercy and Clinton, and then UnityPoint and Genesis. In addition to that, Select Specialty has started to plan with us. So the numbers you're getting from today are just the Genesis and UnityPoint numbers. They don't include, for instance, the ICU capacity that Select Specialty would have, or what they've got at Hammond Henry or Clinton. Those hospitals are a little bit different, but each of them have capability to take, medical COVID-19 patients. ICU patients probably would be transferred. But Genesis is a regional referral center. Every day we receive transfers from other facilities around the region, mainly around a 10 or 15 county area. So we do expect that we'll get transfers in, outside of the Quad Cities.
Thank you. The next question is somewhat connected. Are the health systems coordinating with the rural and smaller hospitals in the QC? Do you have anything you want to add specifically to that, or was that covered in your last answer?
Well, I can comment on that. Genesis has 3 critical access hospitals that are a part of the system, 2 owned and 1 managed, and they're very involved with us in our planning every single day. So that would be Aledo and DeWitt and also Jackson County. So those kind of are some of the rurals that surround the community. We receive transfers from other rural hospitals within the region. So they're very much involved with us. Kind of the ones that are a part of Genesis obviously are more closely involved than the ones that transfer to us.
Would you like to add anything to that, Bob?
No, I think that was covered in the last one, is trying to include them, and they're facing some of the same challenges, and we might get creative depending on how this looks with them, but having them in the discussion and the planning as this goes forward is really important, so we can support the whole region.
Thank you. We have 2 additional questions. Do the health systems have enough respiratory techs and therapists to help manage up to about 160 ventilator patients? And what's the plan to ramp that up if needed? Do you want to start with that, Bob?
Sure. So in a time of high surge and need, that's why we set up our incident command, and trying to look and plan. Our surge plan includes how would we staff if we got to that point. And I think 160 would, as Doug said, would be on the extreme end for us. But for instance, as we've cut back on surgical procedures, could you utilize the skills of anesthesiologists, CRNAs, things like that to help? And so that's what I mean by all hands on deck. And so our medical staff also has a plan on how they could support care in the ICU, respiratory therapy, the med-surg patients, the ED, for people that are trained and competent to do that. So no, I mean, if it was business every day, that would be a big concern, is having the staff on hand to do it. And so we're proactively planning to see how can we do it competently and safely. I will say another avenue sort of related to that in terms of the surge is very high is, opening up to more ideas like telemedicine, where we can have our hospitalist group access other hospitals that can help them complement care. So, I mean, we're detailed looking at every avenue of how do we support patient care as we go, and it's got a little bit different nuance for every part of the surge plan.
Would you like to add anything to that?
Yeah, I think what Bob said is really important to understand, and that is, it's not business as usual, right? I mean, what normally happens with a ventilator is a respiratory therapist is going to run that ventilator, but what you'd see is anesthesia stepping in, and we're very creative, and our professionals are the ones who have done the planning to figure out the scenario of if we needed to surge up to 100 ventilators, who's going to actually work all those ventilators. And so we have 800 physicians on staff and providers, and we've let them define and devise the plans of how we would actually care for X number of medical patients, X number of ventilator patients, and X number of medical patients or ICU patients. And this is very fluid, but you would see non-traditional, just like I mentioned earlier. What's happening right now is you've got 100 nurses at Genesis who are being trained to be ICU nurses or cross-trained for our surge plan that don't have a history of being ICU nurses. Maybe they were an OR nurse. Now, a nurse isn't a nurse, but an OR nurse can make a pretty good ICU nurse if well-trained. And if you're in a pinch in this kind of a situation, it's all hands on deck and everybody's helping out. But I think we've done very similar things, and I would compliment the Genesis medical staff. We have a meeting every day at 11 o'clock, and it's our medical leaders, Dr. Motwani and others, who have helped us define these surge plans and figure out how we would staff these completely.
Thank you both. We're closing in on the 1 hour mark. We'd like to give you the opportunity, if either of you have anything that you would like to give for a closing remark. We can start with Doug for that.
I think there's 4 things that I would emphasize. Number one is that we're prepared, and UnityPoint and UnityPoint, Trinity, and Genesis have worked together. This is a public health crisis, and even though we're competitors, we work together to make sure that the community is going to be cared for. We started our planning weeks ago, and we feel we are well prepared to be able to handle what we believe is going to happen. The second thing is a really important message that I would like to get out, and I'll tell a quick story. And that is, we're here for everybody in the community. We're not only doing COVID-19. That's not the only thing that's happening in our hospitals. We're here to take care of heart attacks, stroke, cancer, emergency surgery, everything that's an emergency. And here's the story. This is something I'm very concerned about. This last weekend, we had 2 people in active heart attack that showed up at our urgent cares because they thought that emergency departments were only caring for COVID-19, which is not the case. Emergency departments handle whatever shows up, any emergency. We keep the patients separate, the COVID-19 patients from all other patients. Heart attacks need to go to the emergency department. Strokes need to go to the emergency department. One of the things that's happened that I'm very, very concerned about is our normal admission rate from the emergency department is 15%. Yesterday we ran 35%, which means people are coming in very, very sick and very, very late when things are happening to their health. So super concerned about that issue. The next point I would make is we have an amazing team at Genesis. These are super smart people, and the physicians and nurses and all the professionals have stepped up to help us develop these plans. We're taking care of people every single day. We're prepared to take care of a lot more people with COVID-19, but every day people are stepping up in an amazing way. And then the last message I would send is just the appreciation of the community, the way the community stepped up. I mentioned Sears Manufacturing and others, whether it's people to sew, provide, gift certificates for our employees for food. It's been amazing. And Bob talked about that as well. So those would be my 4 messages.
Yeah, and I would close saying those are excellent messages, especially the component about heart attack, stroke, trauma. We're all here for you, and we'll continue to be, and you need to get the proper care when coming in. I would just close by thanking Doug and team and all the community health care, the health departments, everybody on the community coalition for coming together in really unique and, as Doug said, unprecedented times to fight for the common good. It's inspiring and humbling to see. I get asked a lot by community members, board members, what can they do to help? First and foremost, take good care of yourselves. hopefully coming out of this, we learn a lot of lessons about things that we should be doing anyway, like hand hygiene, and making sure that we're checking in on our friends and neighbors to take good care of each other. So stay healthy and safe. Keep doing the good work that you're doing because it seems to be working, which is really encouraging. And then finally, a shout out. I'm humbled every day looking at our staff and the healthcare workers. Thank you for supporting them. And they hear you. We hear you. And we know that our communities have our back and they're rooting for us. It means a lot to our front lines, to everybody throughout healthcare, that you're rallying around us. So I would just say we appreciate it, we hear it. And then the final thing I'd say is, you know, this is a changing situation. There's a lot of different information out there. We are happy anytime to be doing this and sharing the situation, what we know, what we're doing. If you have questions, ask. We believe in transparency, nothing to hide. If anything, we want to share and continue to garner your support. So just thank you for the time today. Really appreciative.
Thank you so much, Ed, Nita, Bob, and Doug, for your participation today. Again, thank you to the media for joining us and getting these important messages out to community for our planning and coordination and how we're working to protect the community. Again, we look forward to communicating with you in the future, so please be sure to wait for our messages. Thank you.